first, just what are the emotions that you felt, watching the governor give this institution the shout out that y'all got yesterday?
Well, it was incredible, especially being an alum of this institution. I was telling my folks I've been waiting for this moment for about 40 years, going all the way back to when I was a graduate student. The Medical College of Georgia has been around for 192 years, so and has always been the state's public academic medical center. I mean, for years and years and years. So I think the opportunity for us to show the rest of the state what our folks do day in and day out. We have one priority at this university. I said many times, it's our students and our patients, and I think when you look at what these folks do on a day-to-day basis, our clinicians, they're very concerned about their patients, but they come here because they want to teach too. So then, while they're focused on their patient, they're also focused on the student, on the resident, on the fellow, on a young clinician to get them to where they need to be. So God forbid we should have this pandemic again. These folks are going to be frontline healthcare providers at that point in time. They're going to have an incredible amount of firsthand experience in doing that. So we have been doing this here in Augusta for more than a month now. We started this app on March 13th, I believe it was. Rolled it out to the CSRA and to our employees, and then we scaled up several weeks after that to the University System of Georgia employees, and then from there to the Georgia National Guard members and their families. So we had already had a great deal of experience in doing this. We screened over 9,000 patients, telehealth screening of patients, and have sent about 45% of those to testing sites. We stood up the first drive-through testing facility in this region, as far as I know, and have I got all the bugs worked out of that. We were one of the first labs in the state of Georgia, other than the Department of Health, to have a PCR machine test to do testing that gave us results in hours, not days. And so we have been at the cutting edge of this from the very, very beginning. And these folks sitting next to me are the ones who are in the trenches and do this day in and day out. And we knew, based off our experience, that we could scale this up to the entire state of Georgia. And with the power that the governor has given the Army National Guard, the National Guard here in Georgia, it gives us the logistics opportunities, the backbone to really take this thing to a next level. So we are incredibly excited to be able to unleash this incredible amount of expertise and dedication, enthusiasm that we have here. So it's been a heck of a lot of fun to watch.
I want to make sure I understand, because it sounds like it's in kind of three groups, the way you guys are helping. The one I don't know much about, and I'll circle back to that, is kind of this information hub that they talked about. So, and then the next would be the physical sample collection,
right?
The swabs you're providing to the National Guard, and then the final being kind of what happens after that, right? What happened, the testing that Dr. Coule and Dr. McMullen are doing. So let's talk first, if you would, because I didn't quite understand that, and I know the governor just kind of gave the Cliff Notes, but what is this information system that you guys are going to be able to provide data to other public health officials?
Yeah, let me first give you the overview of it.
Please
and I'll
do.
turn it over to the experts to give you to dive into that.
Okay.
When you think about, we use the word testing, but it's much broader than just doing the in-lab analysis.
Right.
The screening is the first thing that happens, and that's a critical component of this, because there aren't enough reagents in the whole United States for us to treat every single individual in the state of Georgia. And every single individual in the state of Georgia doesn't need testing, and Dr. Coule can certainly elaborate on that. So we have to be able to determine who needs testing, and that's where the screening app comes into place. And the telehealth screening app is so much more powerful than just a series of questions, because you have a provider that looks you in the face and and has an opportunity, and the patient has much more comfort from that. So that's the first stage, is the screening. That's what the app does. Once we screen patients and know, okay, yes, you need to be tested, then we have to get that patient to the closest specimen point of collection, or SPOC as they're called. And that takes some coordination to make sure that we schedule that patient in that particular area. That's where the sampling takes place. That's where the swab takes place. And to have these drive-through testing facilities allows us to keep all these patients out of our emergency department, for one thing. but it allows the convenience of the patient to drive in, have the swab done, and drive on. Once those swabs are collected, so that's the sampling. We've done screening, now sampling. Then you want to do the testing, and it gets sent to the various labs to do the actual testing. But once the result happens, that's where the technology has to come in place to make sure that you're able, from my perspective, to collect that piece of information, get it to the patient promptly, but also get it to the Department of Health so they can do what they're really, really good at, and that is contact tracing, epidemiology, and a variety of other things too. So that's the overview, and all three of those things, the screening, the sampling, and the testing, we've stood up here in Augusta and did it in very short order, and have got weeks and weeks of experience doing all three of those things. That whole thing has now been scaled up to impact the entire state of Georgia. And I'll turn it over to y'all about some of the technology and other pieces of that.
I'll start with the process piece, and Dr. Coule can certainly answer the clinical piece. But, you know, I think that what we've tried to do, IT systems are very difficult to put together and to leverage very quickly. And healthcare people know that very well. One of the reasons we were able to do this is we were very close to deploying the app for our employees to have virtual screening visits as an option for not having to leave their desk or have an appointment at a doctor's office. And so we were able to quickly pivot. That was almost ready to be deployed. We were able to quickly pivot, utilize the testing algorithm that was developed by the Medical College of Georgia, and then be able to deploy that very quickly. The information that the individual gives us through the app is a lot of the good demographic information, as well as much of the medical history, which is captured, and then the physician, before their virtual visit, actually has access to that information. That's also capturable data that will be able to return to the Department of Health. If additional screening is necessary, then the patient is moved along to be registered within our electronic medical record, so that they can be scheduled at whatever site. So for us in Augusta, we've already had a closed loop for our own sites, and so the patient is scheduled, and then that's easy for the results to come through and for the portal to push out directly to the patient. Because it is all in the one spot, that will be easily uploadable to give to the Department of Public Health. And we thought, you know, they've done a lot of work and had a lot of engagement to try to put together a system that would work, but it's hard to start when everything happens. So we thought that maybe we could just augment what they're doing and make and leverage what we have to hopefully help us all scale together better to meet the governor's request and demand for additional testing. So we thought we could augment what they have from an IT standpoint, from a data standpoint. As the president mentioned, you know, they need better data and information and better data flow for contact tracing. And we thought that if we had a closed system that we would be able to do that. And there are between 30 and 40 of these SPOC sites, specimen collection sites throughout the state. And so the other piece of this is leveraging the Georgia National Guard to augment the resources that are already there. These people are there every day doing great work. We just want to make sure that we can enable them to have a process that's predictable with the scheduled patient. We also want to make it easier for all of Georgia to know how they can be evaluated for testing. And so there are some private physicians who are comfortable doing their own screening and doing their own testing within their offices and sending off to reference labs. We don't want to disrupt that at all. What we want to do is just augment the processes that are already in place and streamline where we can so that we can increase the appropriate testing throughout the state.
For people who are concerned about that private sensitive data, how do you protect that data?
Well, that's what healthcare organizations do. We've been told that that's the law for a long time. And so because we're not trying to stand up a new system and we're not trying to do new things outside of healthcare or apply something that might be used for other database management, we're using our electronic medical record. And we're using electronic platforms that are already deployed both with the Amwell platform, the Cerner platform. We'll also be feeding into the Department of Public Health's Google MXD. I don't know the name of it yet.
I don't remember either, but I remember the governor saying it's some acronym that starts with M.
Right, and so you know, that really is to support the contact tracing and the work that the epidemiologist and the Department of Public Health are best at doing. So you know, we already have our systems that we know work, and so we're leveraging them just like we always protect our patient information here at Augusta University Health. Health. So it's just really leveraging that.
Will it only be MCG physicians doing the teleconferencing, or will you guys bring in physicians from other parts of Georgia?
Currently, we have providers both from the Medical College of Georgia, from some are actually from the Dental College, and then also from the College of Nursing. So throughout Augusta University's clinical platform and allied sciences with PAs. So across the board right now, we feel like we have enough providers, but there may be private physicians, there may be medical reservists that would like to be credentialed in the system, and so if we're overloaded, we may need to call on those resources to help, particularly as our physicians begin to ramp back up and get back into the clinics. They have less time to do virtual screening. So, again, part of this is load balancing resources throughout the state so that not one lab is overwhelmed, not one's collection site is overwhelmed, and not one application or accessibility for patients is overwhelmed, but that instead we can, through a centralized command center that General Cardin talked about yesterday, really watch and load balance and really maximize all the resources within the local departments of health, within the regional areas, within all the resources that the State Department of Health has already brought to bear, and just continue to augment that and watch that.
I think, what did he say? Will be the governor's never blinking eye on the coronavirus.
Unblinking eye.
I loved all his analogies. I was like, this guy rocks. And Dr. Toomey talked about using medical students, dental students to do some of that contact tracing because it's a public health fundamental to do contact tracing, but we've never done it on this scale. They just don't have the manpower.
Right.
Talk about that. Some of your medical students, dental students potentially could be doing some of that. Yes,
actually they could be, and I'll defer to Dr. Coule
in a
minute. But we, I think that really deploying the medical students, the nursing students, we're having to be very careful because we do not want to expose any of our medical students to a COVID-19 positive patient. However, there are so many learning opportunities and so much support that without direct contact, they can still contribute and really help us. Some of those students are helping already in many different ways. David Hess, the Dean of the Medical College of Georgia, and his team have actually put together a pandemic course to promote coursework, because this really is a unique opportunity. It was like I was studying public administration in New York on 9/11. When you're a student of public service at a time of crisis, it can really be a unique opportunity for learning, and I think that we've recognized that here at Augusta University, and we'll really take advantage of that, whether it's the Medical College of Georgia, the College of Nursing. The Dental College of Georgia has helped us through innovation of figuring out the swab problem. So, they're just all of these really interesting assets that have come together and to address this, and having all the resources of this enterprise is just incredible. It's fun to be a part of.
The scale of this, Dr. Keel talked about the scale, Dr. Keefer elaborated on the scale. It requires the manpower, and you guys have that. How are you guys encompassing all that AU is, which is a lot?
The great thing about Augusta University is it is a large, complex organization, and it allows us to leverage so many different assets within the system. So we have nursing students, we have medical students, we have dental students, and as Katrina mentioned, our dental colleagues really came to the rescue in terms of designing and printing this swab to allow us to remove one of the major constraints to testing. So I think there are going to be critical components within the system that are going to be necessary for us to be able to open back up for business. One is we've got to have testing, and we've got to have the ability to screen the right people and get them to testing. We've got to be able to procure that specimen. We've got to be able to test that specimen. But then we've also got to assist public health with the contact tracing. And that is something public health knows better than anyone. That is their job, and they do it incredibly well. And they may need some assistance with doing that. And there's lots of assets. The Medical Reserve Corps that the Georgia Department of Public Health has, and the East Central Georgia Health District that Dr. Goggins leads. That organization and that aspect of public health has what's called a Medical Reserve Corps that can use medical professionals and or students to serve some of those roles. Augusta University has a medical reserve corps, and we might be able to leverage that as a way of allowing students to participate in that or through those course electives. But the nice part is that because we do have so many different assets at Augusta University, we're able to bring all of those together and get everybody in the boat rowing in the same direction to help solve this problem.
Let's talk about the dental college, because I was even surprised, and my husband is a dental student, and when I saw that it was DCG doing it, I was even kind of surprised, because I don't think that that's what first comes to your mind when you think about crisis management in a pandemic. Talk about how they've been able to help. I talked to Dr. James yesterday, and even he was surprised. I said, when you guys first started this, did you ever think we would be where we were yesterday, where the governor is asking you to do 5,000 a day? And he said, no, I had no idea. Talk about that a little bit more in that process.
Yeah, I think the neat thing about it is the environment here at Augusta University is one that allows people to raise their hand and say, hey, I've got an idea. And I think leveraging all of your assets and all of the ideas of what is an amazing collective brain trust is one of our strengths, in that it wasn't just Dr. James, it was his residents. And I hear there were students that participated in that activity. And that group of people coming together and the environment that allows them to say, hey, I've got a crazy idea, what if we did this, right? Is a wonderful thing about academia, where people can raise those ideas and those ideas become a major solution.
Talk about the collaboration, because there's a little bit of a good competitive healthy rivalry between DMDs and MDs, and then even amongst MDs and your various, whatever your specialty is. And I laugh about that, and it is, I'm sure funny for y'all too. However, all of those have been, whatever your letters are before or after your name, have been stripped away in all this. Talk about the collaboration. And the healthcare industry has not collaborated like this, I don't think, in history, and it's amazing to watch.
Yeah, you nailed it. I mean, in times of crisis, I think it really makes some of those petty differences fade away, right? And we all realize, the fact that we were frustrated over some friction over the last week that happened before this, that really doesn't matter right now, right? What matters is solving the problem for all of our sakes and for the citizens of Georgia's sake. And it's actually been a great thing to see, because it really does make you realize that all of those little issues really are petty. When it comes down to it, we're all trying to help the citizens of Georgia and help our citizens not face problems related to COVID-19, and everybody's working together to solve the problem.
This is my last question, and it's really for both of y'all, because I know you deal with the dollar signs a lot. But I'm looking at this even future, right? Think of how much money we spend on nasal swabs, on masks, and some we'll never be able to replace with a 3D printed option. But what will it allow us to do moving forward in terms of reusable, recyclable, and the money that we'll save, and the jobs it could potentially keep in our country to continue to 3D print these things instead of buying them from overseas and tossing them?
Well, there's no doubt that this event has uncovered some weaknesses within the health system, right? It's exposed those wide open, and that is that the supply chain is very susceptible. The shortage of laboratory personnel is very, very obvious, right? The shortage of nurses is very obvious. The shortage of physicians is very obvious. And I think it's critical that as we come out of this, that we look at those and go, how do we prevent this from happening again to where we're caught in a vulnerable position? What are we doing to increase our number of students in health professions? What are we doing to create more of our own nurses and physicians and dentists and other healthcare providers, so that that component of the system is not the weak spot moving forward? Certainly there's supply chain issues that factor into this, lab testing capability and lab professionals that have obviously been some of the unsung heroes as part of this, and we need more lab professionals.
And this is the week to celebrate them.
And it is Lab Professionals Week.
It is Lab Professionals Week.
It's
Yes.
Lab Professionals Week, and unfortunately they're so busy running these tests that we can't even really celebrate them properly. But
I
it's
just
a
left
key
Dr. McMullen's lab and didn't congratulate her.
But it is such a key component of what we do that we have to realize coming out of this that we've got some vulnerabilities in the system that we need to shore up, and whether that's the supply chain issues or all of those personnel issues. The personnel issues are key.